So it's 8:01 p.m. We have 59 minutes before we have to get out of our auditorium. So just be mindful for everyone else that's patient standing in line. Thank you. It wasn't clear what Gina's question was. We understood everything that she said. I'm in total agreement, and we will get to the bottom of this. It's why we're here right now. And thank you so much for all the time and all the effort since 2014 you put into this. I do not agree with the raising of the emergency action levels that were raised years ago. I think that is problematic as well. And so there, like I said earlier, there's no fuel that belongs in the Red Hill well, in the shaft, in any of our aquifers, no matter how many parts per billion it is.
We need to investigate that, and you need to know that Roger Bureau is ex-military. He's ex-Navy. He's the one who raised it.
Ernie, do you have any comments on the EALs or any of that was, I know you probably are much more knowledgeable than Rep. Kesa on that subject.
Gina, thank you. I remember you from 2014 and coming out to the community meetings at Moanalua Middle School, so mahalo. And I think you hit all the right points. The reduction in number of chemicals to be tested from 64 to, I thought it was 12, and that was approved by the Department of Health. Also, the raising of the level to test for the minimum acceptable level. I remember in 2014, Roger Burke made the comment to me that you can start to taste fuel at about 100 parts per billion diesel. And, you know, we looked at that very closely, and Erwin's up in the audience here, and you know we studied that, we researched that. We actually agree that when you can start to taste or smell the fuel in the water, that should be your minimum level. And if that level is lower, that's actually more precautionary. So thank you, Gina, for your comments. Malo.
My name is Amanda. I'm actually the Amanda that Representative Kahele spoke about December 2nd in Washington, D.C. He spoke about my family situation and myself. So I have a few questions, and I have some backup information. I will try to go as fast as I can. So I'd like to know, I watched your presentation, what oversight of the military healthcare system is being done? Why 6 months later is the military health services for those that have been affected by the contaminated water still inadequate? There should be more oversight and more providers that are there just for those who have been affected, since everyone else is overwhelmed. What is being done to ensure everyone is in charge of making these decisions or failing to do their jobs with what you have presented are held accountable this time? Case in point, my family is one of thousands that have been affected by the jet fuel water contamination by the U.S. Navy here on Oahu. I am only going to discuss a couple things that have happened. The week of Thanksgiving, 2021, one of my children became very sick, headache, body aches, sore throat, burning throat, went to the ER. They didn't know what was going on because it hadn't been told to us what had happened. They thought it was viral. She missed school all that week. Sunday midday, like everyone has stated, we all smelt something and tasted something. Let housing know, the emergency line, they have 2 hours supposedly or 4 hours to get back to you. No one ever got back to us. But they said that I was number 3 or 4 calling. By December 1st, I went to the ER, and this is what Representative Kahele talks about. I went to the ER because I was in so much pain in my head, and my mouth and throat were so sore, even having open wounds, which I found out from the ER doctor at Tripler that they were chemical burns. The ER gave me some medicine, took a head CT, and discharged me, but shockingly, I found out my discharge paperwork said something completely different. When I questioned why it didn't state what the doctor had verbally told us about my mouth and throat having chemical burns as well as my head pounding being due to the water contamination, the discharge nurse told me that they had a new system and no option for chemical burns in mouth. I have proof of all this. Would you like to hear it? On December 2nd, Representative Kahele spoke about my family situation briefly and brought water from my kitchen to Washington and presented it to all those there. So since then, December 3rd, I went to Moanalua to try to see a primary care physician because I was really sick, and was told that it was due to the fact it was due to water contamination. I had to be seen at the Moanalua Clinic, where the doctor checked my mouth for infection, checked my head, gave me some medicine, and said I should start feeling better. On December 6th, I still was very sick. I drove myself there and in so much pain. My head and my mouth, I was so sick and could not eat due to the burns. The doctors gave me some medicine through shots in my bottom, which were so strong, they had my husband come and get me and take me home. During these visits, I had asked for blood work and was informed there was nothing to test for, and they could not order them. They had been ordered that. On December 16th, I went back to a Moanalua clinic where the nurses, who I will never forget, treated me so awful because she said I should be seen by a primary care doctor because I had gone before to them, to the Moanalua clinic. But that's contrary to what I had been told prior when I had first tried. The people, she went and spoke to a few people, including the doctors at the Moanalua clinic who were going to see me. My husband at the time had joined me at the Moanalua clinic. The doctor was a different one, and two came in, a lieutenant and a lieutenant commander. The lieutenant commander mocked me, asked me if I had eaten spicy food, referencing my mouth. The lieutenant took a picture with his own phone of my mouth and said, see, she's fine. Though I still had visible open burns from the contaminated water. Their demeanor towards me was horrendous. Then they started about my head, talking about seeing a PCM. I explained I had tried. The lieutenant commander all of a sudden was able to get me a PCM appointment. I showed up to the PCM appointment. It was a few hours later the same day. And it was evident the two doctors from before at the Moanalua clinic had informed them of what they thought. The nurse had a huge attitude. I started to explain my situation. She interrupted me and said, "You're just here for your head," and let me know my mouth was perfectly fine, but yet she had not even seen it. So I waited for the doctor, who actually realized something was seriously wrong. I went and spoke to the previous doctor who I saw on December 3rd and 6th. Remember, we're on the 16th now. And then referred me to neurology. I got the neurology referral to Tripler Neurology. The secretary there, I called the following week because it takes time, and the secretary there informed me that she would have to check with the doctor because they said it was routine. I called back. She told me to call back. I called back. She was annoyed. I called back, so she referred me out. That was probably the best thing for me. I was referred out to the healthcare system out in town. The neurologist at that point ordered up a workup and an MRI. It was determined my main nerve in my head was damaged from the water contamination. Since that point, I have had 4 procedures on my head, with another one scheduled shortly. They are very painful and debilitating. I get so sick, I literally sleep by the toilet for 1 to 2 days. Furthermore, I was hoping, first off, I have no trust with the military healthcare system as of December 16th. And therefore, I am very happy to be out in town. But in order to get anything extra, we have to go through them. So I tried to get a referral because in April, new symptoms had appeared, which I was informed could be related and are related to the water contamination. I was told I needed an appointment. I called, didn't get anyone to call me back. I went in, made the appointment. In order to make my appointment, I had to meet with a nurse who asked me 50 questions. And it was the same nurse from the Moanalua clinic. And so I finally get my appointment, and then my symptoms got severely worse, and I asked, can I please just have a referral? And they said I had to show up. I showed up, and I was informed that the doctor would examine me by that nurse. The doctor did not examine me. He just ordered tests. They did an ultrasound on June 10th. And I had to wait till the following week to get any results or any information. Mind you, I'd asked now at this point 4 times for a referral. I ended up having to go to Kapolani ER that weekend on the 12th of June. And Kapolani flat out really was shocked, but nonetheless, they wanted me to see a specialist, the specialist that I was asking for a referral for. So there you go. I got somebody outside. I have my meeting, my appointment on Friday, the 17th, with the military doctor, who informs me that the recommendation in-house was that if there's no other side effects, that you don't need one. There were side effects. He was fully aware. There's been severe side effects. And then when I stated I had gone to the ER, and mind you, I had messaged them letting them know I had gone, he told me, well, we have no data or information on that. And I said, I had messaged you. He goes, we have 72 hours to get back to you, ma'am. And I said, it's been longer than 72 hours. I messaged you Tuesday morning, and it was Friday afternoon. And then he said he would bring it up with the nurse manager. My point in being is, 6 months later, the same crap is going on for everyone trying to get assistance. This should not be. This should not be this hard. This should not be going on. Everyone's fully aware of what is going on this island. Healthcare should be there for us, and especially if it's documented, what is going on? What are you guys going to do? You guys have allotted money to healthcare. What are you doing for oversight? It's great that it says it's going to take care of the military families or take care of the people, but what does that actually mean? If you guys need help writing that, you let me know. I will help you. But I would like to hear from you. What are you guys going to do for oversight?
Well, it's just, I don't know how to express my feelings over your 7-month now ordeal. And I'm so sorry about that, first of all. It should not have happened to start with, and certainly you should not have been through the last 7 months. So the first thing, and I would say this to anybody who has a personal story in line, is we want to look into your personal story and to ask about your own situation. So if you don't feel you're getting the care that you need, and clearly many of you feel that way, which is obviously a takeaway from tonight for sure, then we need to do something about that. We want to help you individually, but more of greater concern also, or equal concern, is the bigger picture of whether that overall outreach still exists from the military, affirmative action to deal with your health concerns, affirmative reaching out to you to try to help you with your own situations, whether you have them today or not. And so from an oversight perspective, I think we would say that that's our job, is to oversee. The money that is up on the screen here is available to address healthcare concerns and should be utilized for that purpose. So certainly I heard you loud and clear, a number of you, on this subject, that this is clearly an area to go back and deal much more assertively with the military on. So, that's what I'm going to do about it.